Hi, my name is Karen Sanders, and I'm a registered nurse and owner and founder of the RN Patient Advocacy of North Carolina, PLLC, and also the Holistic RN Patient Advocacy Training Institute. It's my pleasure to speak to you today about our next upcoming course that's going to start on August 17th, 2022, and this is going to be a 4-month course training nurses to become RN patient advocates and starting their own private practice. And I want to talk a little bit about why I started this course and why it's important to me to have hundreds of RN patient advocates all over the country, because we have a healthcare system that is very difficult to access. So as an RN patient advocate, we help patients and families navigate the dysfunctional, silo-driven, technologically impossible healthcare system with less stress and more peace of mind. Let me talk about this picture that I had commissioned about 15 years ago. This is called the Phoenix Nurse. And one of the things that really strikes me about using this picture now is that we as nurses have been through a very chaotic, rugged time working with patients and families during the COVID outbreak, and it's been very difficult because we are working in extremely short staffing situations. We don't have enough equipment, we don't have enough supplies, and short staffing has occurred all over this country in every setting. So it could be in home care, hospitals, independent living, assisted living, skilled facilities, can be even in urgent cares, can be in palliative care, can be in just in delivering home care of people in your own home. We also know that we're going through a very significant RN shortage, the likes of which we haven't seen in many years, and we know that nurses are leaving the profession in very large numbers because they're feeling very frustrated and undermined and under assault by patients and families. So consider thinking about going into private practice as an RN patient advocate, where you can have total control of your schedule, you can have control of the patients you see, the number of patients you see, how many days per week you work, what are the hours you work, and to give patients and families all the attention and time they need in order to help explain illnesses to them, how to show them marvelous apps like mayoclinic.org, and to do other things with great wonderful feelings about yourself and how you are giving back to the community in which you live. So this is the Phoenix Nurse. You're going to see the fire down here at the bottom. This is the fire that we have all experienced as nurses, being short-staffed, under-promised, and not having enough equipment, but now we're rising from the ashes. This is the lamp representing Florence Nightingale. Here's our heart. We are carrying our hearts in our hands and our souls, and then each of us have a little bit of a broken heart when we've worked in such desperate, difficult situations. The course is 4 months long. We are accredited by the American Holistic Nurses Association for 35.9 contact hours. We'll be submitting documents to increase those numbers to 40 contact hours. We have 20 adjunct faculty members speaking to us during the course on a variety of topics, such as creating your own business plan, how to set up a LLC, a limited liability company. In North Carolina, it has to be a professional limited liability company, so we have to go through our North Carolina State Board of Nursing. Not sure if that will happen in your own state. We have people talking about marketing and setting up your website. We have a wonderful speaker who is very legendary in our parts, who is a fabulous speaker in that. We also have speakers talking to us about the COVID epidemic and where we are with numbers, where we are with the most recent virus counts. We also have people coming in talking about other complementary ways to treat pain and suffering, such as acupuncture. We have other speakers coming and talking about actually formulating your business, starting your business. How do you have separate bank accounts? How do you take care of yourself financially? And how do you get extra money to do all this? So we would love to have you call or consider getting more information. You can go to my website, which is rnpatientadvocacytrainingnc.com, or you can also call me or text me at 828-295-1140, or you can also email me at karen@rnpatientadvocacy.com. So we're all Phoenix nurses in one way or other, and it's really great to come away from the fire, come out of those ashes, and reconfigure ourselves, rebirth ourselves as nurses going into private practice and being RN patient advocates to serve the needs of our families and patients who are so overwhelmed with the healthcare system. Come be an RN patient advocate. It is great speaking with you today. I'm Karen Sanders. Have a beautiful day.